IAMP Honors Program. I'm Riley, and I'm here with Bryce of the St. Clare Health Mission for National Volunteer Week. So Bryce, can you walk me through kind of what got you interested in public health and how you came here, and then maybe your future plans as well?
Yeah, my public health passion started in high school, actually. I was a pretty cynical kid, really hard to be around, believe it or not. And so my parents at the time said, oh my God, we have to show this kid that there's more to the world than just high school and his own mind. And so we went through a volunteer program through one of the local healthcare systems, Gunderson Health System. They have a program called Global Partners. And at the time they had a site in Tanzania, Africa. And so we had a group of surgeons, psychologists, teachers, lots of people with varied backgrounds. And we went into a small community and did health assessments, talked about social determinants of health, and then did same-day operations.
Oh, wow.
And so my passion for public health really started halfway across the world in Africa, where I was able to be part of a collaborative team, even as a high schooler, help and do a lot of the background things. And it really instilled kind of a passion for preventive care, thinking beyond just the day-to-day. And so that passion and that experience has stemmed into a pretty intentional timeline for going to school, studying environmental science, looking for extracurricular experiences, leading me to St. Clare Health Mission, and ultimately in the fall, Masters of Public Health.
Awesome, awesome. And so where'd you go to undergrad?
Yeah, I graduated in 2017 from Drake University, which
Awesome.
is a small college in Des Moines, Iowa. My background was environmental science and Spanish, actually. And I studied environmental science kind of with a pathway for environmental health. The blessing and the curse about public health is it's so broad.
Right.
It can really be anything from, a business model to clinic care, environmental health to child and maternal health. And so I took environmental science as a pathway to ultimately approach a master's.
Gotcha. And that will be where? Where's the master's?
Yeah, I will be attending the University of Minnesota Twin Cities.
Awesome.
In their Masters of Public Health, Administration, and Policy.
Congrats, that's huge.
Yeah.
Big news. So Bryce, can you tell me a little bit about the St. Clare Health Mission and how you got started in it, and just kind of maybe a little history?
Yeah, absolutely. The St. Clare Health Mission has been serving the La Crosse community for 27 years. And it was actually born out of a collaboration between the two local healthcare systems, Mayo Clinic and Gunderson Health System, as well as La Crosse County. The county had done a health assessment and found that a lot of our community members who were the working poor were using the emergency room as primary care. And for those of us who have the privilege of insurance, the costs that those individuals going into the emergency room, as they accrue and ultimately can't pay that spills over onto all of us.
Right.
And we know that emergency room for primary care services is just not an efficient model of care. So really, this collaboration emerged out of these three partners, and ever since we've been serving community members. In that, the mission, St. Clare Health Mission, is not the only free clinic across the state. There are many, each serving communities in different relationships and pathways and different models. And so there is an overarching organization called the WAFCC, the Wisconsin Area Free and Charitable Clinic Group. To my knowledge, that's the acronym. But would definitely reach out, look in your area for free health clinics, because we're only one model in one part of the state.
Right. So could you tell me a little more about how COVID-19 has kind of changed you guys' approach and changed how the way things go around here?
Yeah, absolutely. COVID-19 has definitely kept all of us on our toes. And again, goes back to, we need to stay flexible to continue addressing and providing care for those that fall through the cracks.
Right.
And so I would even parallel to 27 years ago when we first started, and we still, even now, want to ensure that our clients are staying out of the emergency room as much as possible, while at the same time being conscientious that 99.9% of our volunteers, of which many are working in the healthcare systems, we want to reduce their contact, make sure that they're healthy because they're going into the healthcare systems and working with vulnerable patients too.
Right.
So really we've switched into more of a telehealth approach. So no patients are allowed inside the building. And Jason, the current executive director, and I are the only individuals that are going to be in contact with the patients outside to get them connected through one of our phones or their own personal phone and bridge the appointment essentially over the phone.
Gotcha.
So different model. It's definitely different, but staying flexible is the name of the game.
Right, for sure. So now we are in the social workers kind of office, I guess. We got the mood lighting going. We just came in. This is the hallway over here is where we would have come in, and social worker is Bryce today. So Bryce, what can you tell me and AMP about what the social worker does, kind of? What's their main role?
Yeah, so after patients establish with reception, they check in and they're a new patient, or we follow up every 3 to 4 months. We just want to check in, see how things are going. Our population that we serve here is very transient in terms of employment, moving between states, as well as just identifying other needs that they might need outside of medical. So really the social work's role is for us, one, to determine eligibility, and see if there are other pathways that we can help them gain insurance. Because a more traditional healthcare model is going to have more comprehensive care, and we do want to push people into that system.
If they can qualify, right?
Yep. Yeah, it's kind of confusing, but our eligibility is based on the federal poverty limit line. So we see between 100% and 200% of the federal poverty line based on the number of dependents that one has. So as a single individual, I could make between $1,000 and $2,000 a month and be eligible for services here, knowing that if I fall under 100% of the federal poverty line, I should apply for Medicaid, which in Wisconsin is called Badger Care.
Gotcha.
Super confusing.
Yeah.
But that is a service that we can help people sign up for on site. And if an individual makes over 200%, then we can have a conversation about the Affordable Care Act, employer offered insurance if they are working, and help navigate complex systems.
So now we are sitting at what I am told is the PAP desk, and I'll hand it off to Bryce to go into that a little bit more.
Yeah, so the PAP desk, which is the Patient Assistance Program desk, is a pathway for us to receive free medications directly from drug companies. So patients will, with their paper prescription, because we're old school, we'll bring this back, and we have a running list of companies for specific medications that they dispense, and we essentially match the prescription to the availability, fill out a form, and that way we receive free medications. Insulin, Lantus, is one of our medications that we do get for free, and if you didn't know, insulin is outrageously expensive. It's like $300, $350 per unit. Yeah, which is super unfortunate because it's not an elective, it's really not an elective medication.
Right.
Individuals need it for their well-being. At the same time, this desk and the volunteer work that happens here, which does not require a medical background, is super important because we, as the St. Clare Health Mission, are 100% community sponsored in terms of finances. So we need to be good stewards of those that support us financially, and a lot of that is completing these forms, receiving drugs for free, lest we pay $350 per individual that comes through.
That's cool. I didn't know that people without a medical background can do this, so that's awesome. That's good. That's cool. So just a little wrap up, I guess. How can specifically high school students and undergraduate students that are interested in the healthcare professions, how can they get involved in places like this? What kind of roles can they play? How available are clinicians for shadowing? That kind of thing.
Yeah, I would say, if you're from the La Crosse area, certainly reach out to us. and we have information online. Otherwise, connect with your either healthcare or really any kind of social service agency to see what opportunities they have available. For us specifically, certainly helping with reception in the front, kind of the PAP desk, even as a pharmacy tech to count pills up to 90 or 270.
Right.
It doesn't require any specific medical training, and then we would love the assistance.
Yeah, I think, and can you, what's the PAP desk stand for again? What is the?
Yeah, sorry, it's the Patient Assistance Program.
Okay, Patient Assistance Program. Is that something that kind of, do you know, maybe you don't know, but does every kind of free clinic have a certain or a similar position, I guess, or is that kind of unique too?
Yeah, I hope so.
Right.
To my knowledge, if they're not, they should be, because it's a great resource to reduce costs, engage more individuals as part of the process, and collaborate. And
then so phlebotomy, I'm not sure, I guess, on the certification process, but I think high school students and undergraduates for sure can get involved. I have a couple of friends that are phlebotomists, so they can definitely volunteer here too. So yeah, I mean, there's a lot of opportunity. And so with the shadowing, is that just kind of per clinician? Is that through you guys, or is that through the clinicians individually, I guess? How do you know how?
Yeah, that's a great question. I would say, because our clinicians are volunteer-based, we certainly can't mandate that they do something. Right. The easiest pathway, which has been in the past, is if someone has a relationship with a clinician already, would be to reach out to them and say, hey, would you mind if I came and shadowed? So that way it's more of the volunteer clinician or nurse relationship, and not like someone such as myself or the director saying, like, you are going to be shadowing.
Right, yeah.
Or someone is going to be shadowing you. Just in terms of like a responsibility aspect.
Yeah, exactly. I can definitely see that. And I guess the shadowing isn't necessarily only for the clinicians or the nurses. You can certainly shadow the interpreters, the medical interpreters, or anything like that, or the pharmacy techs and the pharmacists also. So yeah,
absolutely. There's also, I would be very surprised, we have lots of miscellaneous projects, such as reorganizing 2,000 charts, because we are all chart based. There are certainly projects that we could use help on. So lots of behind the scenes things. Yeah,
and just a personal anecdote, I guess. I first got here because of shadowing a doctor that I had a relationship with, but as soon as I got here, I just kind of fell in love with the place and all the people involved. And since then, I've been every Tuesday or Thursday night that I can make it, I try to get here and help Bryce with whatever he's got. I always tell him, like, give me your hardest stuff, the stuff that you want to do the least, because I'm only here for a couple hours a week. So, and even if that, and he's here, I mean, who knows? I'm probably countless hours. So like anything I can do to help, I always let him know, and he's always got something for me. So they definitely, even if there's no kind of defined role, they can definitely use you for sure. So
yeah, get out, be an active participant. Volunteering is really an act for a statement saying this is what you want your community to be like.
Yeah, awesome. Thanks, Bryce. Thanks so much for meeting with me today on this Wednesday afternoon, gloomy Wednesday afternoon. And I can't wait to see what the future holds for you.
Yeah, my pleasure.